It's 11 p.m. You're scrolling through your phone in bed. The blue light washes over your face. 300 social media friends, dozens of unread messages, and you've never felt more alone. That feeling you can't quite name? Scientists now call it an epidemic, and the World Health Organization has officially declared it a global health emergency. This isn't about feeling sad at a party. This is about biology, about inflammation markers and cortisol levels, about why loneliness may be killing as many people as smoking. 100 deaths every single hour. That's the number the WHO attached to loneliness in their landmark 2025 report. Let that sink in for a moment. 871,000 people every year, gone. Not from cancer, not from car accidents, from a feeling we've been told to simply shake off. And here's what caught my attention. Nearly half of young adults across 8 different countries, vastly different cultures, all reporting the same thing: chronic loneliness. Let me take you back to June 2025. Geneva, Switzerland. The WHO Commission on Social Connection releases a report that changes everything we thought we knew about being alone. The Commission wasn't studying mental health in a traditional sense. They were looking at something far more fundamental: whether human connection itself should be considered a vital sign. The findings were stark. 1 in 6 people worldwide, that's over 1 billion human beings, experiences loneliness severe enough to damage their health. The WHO report found that social isolation increases premature death risk by more than 60%. 60%. That's comparable to smoking 15 cigarettes a day. And unlike smoking, we don't have warning labels. We don't have public health campaigns. We've been treating loneliness like a personal failing rather than a biological threat. Here's what happens inside your body when you're chronically lonely. Your brain perceives isolation the same way it perceives physical threat. It goes into survival mode. Cortisol floods your system. Inflammation markers spike. Your blood vessels constrict. Your immune function drops. This isn't metaphor. It's measurable, documentable physiology. The Commission found loneliness increases stroke risk by 32%, heart disease by 29%, and here's the one that stopped me cold: dementia risk goes up by 50%. But the WHO report wasn't the only bombshell. In February 2026, researchers at Washington University published something that made public health officials sit up. They surveyed nearly 8,000 young adults across 8 countries: Brazil, France, India, Indonesia, Nigeria, Philippines, Turkey, and the United States. 39% reported loneliness. Nearly 4 in 10 young people across vastly different cultures, economic conditions, and social structures, all feeling profoundly disconnected. Dr. Salma Abdallah, who led the study, put it plainly. People who reported loneliness had almost 3 times the odds of meeting screening criteria for depression, and nearly 4 times the odds of generalized anxiety. 4 times. That's not a correlation you can dismiss as noise in the data. So here's the question that keeps nagging at me. If loneliness has such dramatic health effects, why hasn't it been treated like the crisis it clearly is? Part of the answer is that we've medicalized everything except the thing that might matter most. We track cholesterol. We track blood pressure. We don't track connection. The American Heart Association added to this picture in 2026. They found lonely adults had significantly higher risk of developing degenerative heart valve disease. Even after accounting for traditional risk factors, even after controlling for genetics, something about loneliness itself was damaging the heart. Literally, physically damaging it. The biological mechanism makes sense when you think about it. Humans evolved in tribes. Our nervous system literally developed expecting regular social contact. Take that away, and your body reacts like it's under siege. Stress hormones that were designed for short-term threats become chronic companions. Your system never gets to rest. The WHO found that young people and those in low-income countries are hit hardest. It's not just a rich world problem. It's not just an elderly problem. It's everywhere. And that's where the story takes an interesting turn. Because if loneliness is a public health crisis, it implies something radical. That connection isn't optional. It's medicine. The WHO's commission was explicit about this. They're calling for social connection to be treated as a vital health behavior, the same category as diet and exercise. Think about what that means. Your annual physical might one day include questions about who you talked to this week, whether you felt heard, whether you touched another human being. So what does this research suggest we actually do about it? The data points to some practical approaches worth considering, and they're probably simpler than you'd expect. First, quality appears to matter more than quantity. Research suggests that one meaningful conversation may do more for your health than a dozen superficial interactions. Consider joining something with built-in structure, a weekly class, a volunteer group, a book club. Recurring commitment creates the conditions for connection that's hard to manufacture otherwise. The research also suggests reaching out proactively rather than waiting. Loneliness tends to make us withdraw, which creates a self-reinforcing cycle that's difficult to break. And here's something important. Feeling lonely despite having relationships is completely valid. It's not about counting friends, it's about whether those connections feel real. Some researchers suggest limiting passive social media scrolling, the kind where you're consuming but not engaging. Active participation seems to have different effects than silent observation. If loneliness persists despite your efforts, it may be worth discussing with your healthcare provider. It's a legitimate health concern, as real as any number on a lab report. Now, I want to be honest about the limitations here. Some researchers argue we still don't fully understand whether loneliness causes poor health or whether poor health causes loneliness. The direction of causality matters, and the honest answer is that the science is still evolving. What we can say is that the association is consistent and strong enough to warrant attention. There's also debate about solutions. Should this be treated medically, with prescriptions and clinical interventions, or is it fundamentally a social problem requiring community-level change? The WHO is betting on both. Their recommendations include training healthcare providers to screen for loneliness, but also investing in community spaces where connection can happen naturally. Some critics worry about medicalizing normal human experience. After all, we've all felt lonely at some point. Where's the line between ordinary sadness and diagnosable condition? It's a fair question, but the researchers argue there's a difference between temporary loneliness after a move or breakup and chronic disconnection that persists for months or years. The 8-country study specifically focused on persistent loneliness, the kind that doesn't resolve on its own, and that's where the mental health associations were strongest. What strikes me most about this research is how it reframes an emotion we've been taught to feel ashamed of. Loneliness isn't weakness. It's a signal, your body telling you something is wrong. Just like pain tells you to move your hand from a hot stove, loneliness evolved to tell you to seek connection. The problem isn't the feeling, it's when we ignore it. The WHO estimates these 871,000 annual deaths are preventable. That's almost 1 million people every year dying from something we could address, if we took it seriously. And unlike many health interventions, the prescription for loneliness doesn't require expensive equipment or pharmaceutical research. It requires us to remember how to be with each other. If you're finding this helpful, by the way, consider subscribing. We dig into research like this every week, translating what scientists are discovering into things you can actually use. Now, everyone's situation is different, and what works for one person might not work for another. You should talk to your doctor before making significant changes, especially if you're dealing with depression or anxiety. But here's what the research suggests is worth trying. Start small. One real conversation this week. One activity where you might meet someone new. Build from there. Notice when you're substituting scrolling for connection. That's not judgment, it's just data. The research suggests passive consumption may actually increase loneliness rather than relieve it. If you're already struggling with mental health, loneliness can make everything harder. The Washington University study found that connection, 3 to 4 times the impact on anxiety. That's significant. The WHO's intervention isn't just about individual choices, though. They're calling for policy changes, urban design that creates gathering spaces, workplace policies that allow for human connection. Because here's the uncomfortable truth: we've designed a world optimized for efficiency, productivity, and individual consumption. Connection often gets treated as a luxury we schedule in. Maybe that needs to change. Maybe the next great public health campaign won't be about eating vegetables or quitting smoking. Maybe it'll be about picking up the phone. Remember, social isolation increases premature death by 60%. That's not a typo. That's the largest risk factor most people have never heard of. And here's what stays with me. We've been telling lonely people to go make friends, as if connection is something you can just decide to have. But the biology says otherwise. Chronic loneliness changes your brain chemistry. It makes social interaction feel more threatening, not less. Breaking the cycle requires understanding it's not just about willpower. So if you're lonely, maybe start by being gentle with yourself. The shame doesn't help. The research suggests it actually makes things worse by driving further isolation. This isn't a personal failing. 1 billion people feel this way. The WHO has declared it a global emergency. If you're struggling with connection, you're in the majority, not the exception. What the WHO has done is remarkable. They've taken something invisible, a feeling we couldn't even talk about without embarrassment, and given it the weight of smoking, obesity, physical inactivity. 100 deaths an hour. It's a devastating number. But here's the thing about numbers: they can also measure change. They can track progress. They can show us we're getting better. The research is clear. Connection isn't optional. It's not self-indulgence. It's health. And maybe the most powerful medicine available to us is simply each other. Thanks for listening. I'm genuinely curious what you think about all this. And remember, this is information, not prescription. Always consult your doctor if you're struggling. Take care of yourselves and each other.